Of all media people. So I would like to take you through my to our efforts, to our little introduction of our project. So the government, I'll take you through where the government has, where there is low coverage rate, or there are the pockets which are hard to reach. In order to expedite the vaccination, U.S. Agency for International Development, that is USAID, supported momentum routine immunization transformation and equity project, and has partnered with ISRN as an implementing partner in 4 districts of Meghalaya. And these 4 districts of Meghalaya are West Khasi Hills, South Garo, East Garo, and Ri-Bhoi. So basically, we are working in these 4 districts. So, we are Indian Social Responsibility Network (ISRN). We are an NGO, National Level Non-Governmental Organization, working in field of COVID-19 vaccination program in 10 selected districts of Meghalaya and Nagaland. So we are currently working in Nagaland and Meghalaya, in 6 districts in Nagaland and 4 districts in Meghalaya. And if I say 4 districts in Meghalaya, again I'll tell you it's West Khasi, South Garo, East Garo, and Ri-Bhoi. To support and amplify the government efforts in successful vaccinating the eligible population to cover the left out and non-vaccinated population above age 12. So now it is open for above age 12. So we are now focusing on above 12, with special focus on people with co-morbidities and marginalized one, such as tribal people living in hard to reach areas. ISRN has been doing different types of field level activities for amplifying the COVID-19 vaccination program in the state of Meghalaya. So we are doing awareness camps, we are supporting vaccination camps, we are doing wall writing for the awareness of people around. We are doing miking activity to let people around about the vaccination centers and about the COVID-19 vaccination programs. So we are doing IPC, interpersonal communication, going hard to reach areas. We are doing IPC, we are making them aware, we are one-to-one, we are interacting with people. We are training the healthcare and frontline workers for COVID-19, because COVID-19 is very new to us. And although it's been 2 years, but still people like healthcare workers have certain confusions and all. So we train them, and we have vaccine on wheels, where we hire some vehicle, and these vehicle help in vaccination program. Then we do regular meeting with stakeholder at state and district level. Stakeholder at state and district level means we have health people, health officials working at district level, health state level. So we meet them regularly. We do the meeting with them to understand what they want from us and how they are going, how we can amplify their program, how can we support them. So we do regular meeting. We do partnership with stakeholders such as self-help group, because self-help group are basically very active people, and they have influence in the tribal areas, they have influence among the community people. So we collaborate with these self-help group, because it is very difficult for us to reach out those people. So we collaborate those active self-help groups. Faith-based organization, we do the engagement with school, colleges and institutions, just to amplify the government effort, so just to reach out the people for vaccination, to make them aware. Next in the pipeline is to cover the age group of 12 to 14. So now we are also focusing on 12 plus years of children. Now this vaccination is open for 12 to 14 years. So now we are also focusing on this age group, with 14 plus eligible ones in the state in coming days, and we look forward to collaborate with voluntary organizations in the above mentioned districts. With these initiatives, we hope to further support the government to accelerate the uptake of COVID-19 vaccination, and with all these initiatives, I hope we'll fight with this COVID-19. That's it. Thank you so much. That's why we are doing the training for frontline healthcare workers so that we can make them aware also. And as of now, we have not encountered this thing. But again, I would say that we are doing the training of frontline workers and nurses and healthcare staff about COVID-19. This is all about what we can only aware them, we can only motivate them for vaccination. Other thing, government is doing their part, and I think government is doing fantastic here. We need to just make them aware, make them mobilize the people to the vaccination centers. That's the only thing. That's the gap which we are filling up, which are not vaccinated, and that's how we are making our strategy and everything. We are also amplifying their work. We are not doing the duplicacy. We are working in collaboration.
But they are also doing the same. They are also going to.
We are just supporting the project of the government. We are tying up with the officials and we are going in line with the government project. So we are very much doing in line with what the government is doing. So we're just amplifying and supporting.
But what is it
The
that
thing is, that's the thing. Because government cannot have their complete focus on one thing, COVID-19, they have to focus on every health areas of. That's why they collaborate with other NGOs and all, so that we can have our own. We have a complete focus on COVID-19. Government can spread their focus on other areas as well. So we can do the awareness part. They are doing the vaccination part, and they are also focusing on other areas. So that's why there is a collaboration.
Have a various activities like part of awareness, like we have maybe miking activities, or we have like various, we take the help of street plays, or maybe in the form of small role plays. So getting the awareness, yes, I understand it's a challenge, but along with the government we are trying our level best to get as much participation as possible. Till date, yes, you can say that we are on the we are on the way of like achieving a good number of percentage, but we are trying our level best through various like awareness activities along in line with the government program.
Yes, we get government support, we get state government support, we get district government support. So there is support from all the sides from government to us.